Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center. Today we're going to talk about sun damage. So sun damage is a very broad term, but it basically occurs because you get UV exposure that starts to damage the skin in multiple ways. And one of the major problems is the loss of collagen that happens from the oxidative damage that occurs from the UV rays, but also you can get pigmentary issues where you can either get hyperpigmentation or in some cases even lose pigmentation and spots and create sort of this dyschromia. And the skin can start looking kind of leathery with time with a lot of sun exposure. It can also thin the skin out and you can start having more prominent vessels kind of appearing on the skin. And also, of course, the dreaded loosening of the skin and sort of the sagging that occurs can also be induced by UV light. We have 9 exam rooms in this office. Every room has some technology that can actually help address skin damage from the sun. So in this room here, we have what's called the broadband light. And this is a technology that will address pigmentation and vessels and can also help to tighten the skin. So the good thing is that we can actually, unbelievably, reverse some of the sun damage that has occurred. For prevention, however, you should definitely use sunscreen every day, and that should be just an absolute must-do for you every single day. Even if you're not going outside, just make it part of your routine habit. The other thing that can really help is just even applying a layer of makeup that is more that will help to reflect the light off of your skin and protect your skin. So that can also be helpful. And don't forget your lips, and also wear sunglasses and such to prevent UV damage to your eyes at the same time. But also be mindful of your neck and chest areas, and especially your arms and hands. You don't want those areas to start aging as well. Of course, if they do, most of our technologies can be used pretty much on any part of the body to help reverse that sun damage. So we also have in this room the profractional laser, which can help with tightening the skin back up and also dealing with the elastosis or kind of that laxity that happens from sun exposure. All right, and this is one of my favorite procedures for skin tightening, which also can be induced by the sun in terms of loosening the collagen and elastin fibers. But also, of course, some of that is hereditary and just occurs with natural aging as well, even if you weren't exposed to the sun. But certainly the sun exposure accelerates the whole process. So to reverse that, we can use something called Ultherapy that goes deep under the skin and acts like a facelift, but without surgery. So it's going to help tighten that connective tissue that is normally sutured during a facelift, and we can see the layers of the skin during the procedure, which is what makes it so specific. And then it's also going to help stimulate new collagen growth. So this is a fantastic procedure. I also wanted to remind you some other things you can do besides sunscreen at home is you should all be using, if you can tolerate it, some retinol or Retin-A. Even if you use it a few times a week, it is clinically absolutely proven to help reverse some of the sun damage on your skin, and will help with cell turnover and also repairing some of the damage that has occurred. In the morning, you should use an antioxidant serum such as vitamin C, and there are several others as well. And if you've had a procedure where we're actually penetrating through the skin, such as microneedling or even Morpheus or any of the RF microneedling tools, then have us apply PRP or exosomes to your skin. That is also going to help repair some of the damage and help you heal faster. So in this room, we have a bunch of different lasers that will help with sun damage. So first we have our Q-switch laser, which will help to break up pigmented cells. And this can be used in darker patients as well, and can also be helpful for melasma. And then we have the Q-switch 532 nanometer laser, which is perfect for really stubborn brown spots that are not going to go away, perhaps with BBL or other lasers that we might be able to do. So the Q switch is a little bit more powerful that way. We also have microdermabrasion and hydrofacial in this room, which helps to take off that dead skin and helps to force the skin to regenerate itself. So that's also extremely helpful. And then we have fractional radiofrequency devices that are going to put energy into the skin and force your skin to make new collagen and become smoother in the process and tighter and also more evenly pigmented. In this room, we also do all kinds of peels, again, just to take off that dead skin and help you regenerate. So we also have procedures like Cosmelon and VI peels, glycolic and salicylic peels, so all kinds of different products that can be applied to the skin to help. And then we have the Fraxel laser, which is one of the fractional lasers we have that again causes little dots of damage into the skin very specifically and very controlled in a heated manner, and that's going to help regenerate new collagen in the skin. And of course, microneedling, which has become very popular and is a great tool to again cause little dots of injury throughout the skin, millions of little punctures that are going to basically force a wound healing reaction, and that's going to help regenerate new collagen and also help get rid of some of the hyperpigmentation and even scarring if you have it. But excellent tool, and that can be done less aggressively or more aggressively depending on the body area and what we're trying to accomplish. And again, this is a great tool where we can put PRP or even exosomes over the skin to help you recover better and faster and get the very best results.